Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, with another of our COVID conversations today for October 20th, 2022. Joining me today is Mitchell Kilkenny, who is our Tobacco Prevention Coordinator. He's joining us from the desert, I guess. And so we'll talk a little bit today about tobacco, but first we'll start with COVID. And as always, if you have questions, please send them to us at Facebook, questions at douglaspublichealthnetwork.org, and we'll get to them the next time. We have just one question today that we'll get to. So the world of COVID is actually pretty quiet. In the world, the number of cases is pretty flat, slightly increasing. And the slight increase is due to a marked increase in disease in Central Europe. So France, Germany, Italy are all starting to see a fairly good sized increase in the number of cases, although they have relatively high vaccination levels and are not yet seeing a huge increase in hospitalizations or deaths. You know, we always look at the UK because the UK has been the best predictor during this entire pandemic of what's going to happen to us 6 or 8 weeks later. And they're seeing a mild increase in disease, about 50% up from about 3 weeks ago. They're starting to see a slight increase in hospitalizations, but it has really not been overwhelming in the UK. What we are noting in Central Europe and the UK is they're already starting to see some flu, and the combination of flu and COVID is putting a bit of a stress there. But again, because of a high vaccination rate, they're generally not seeing lots of negative disease. In the US, we're seeing a declining number of cases and a declining number of hospitalizations. That's the good news. Most of the US is quiet, although we're beginning to start to see an increase in disease in the most northern parts of the country, especially in Maine and Vermont, where we're starting to see a little bit of an increase in disease. There's been this funny increase in Kentucky and West Virginia that we've not been able to explain, but generally things are quiet in that world. At the country level, we're looking at variants. Again, it's mostly BA5 at this point, although we're worried about the BA 4.6 and the BA 2.75, two of the subvariants of Omicron, which seem to be less well controlled by either previous disease or by vaccination. And what we're worried about is that they may increase in the fall as more and more people have immunity to BA5, but may not have good immunity to BA 4.6 and BA 2.75. And then, as always, this is a really crafty virus, and we're starting to see new mutations, especially the BQ strain, which we've not seen any of here yet, but we're starting to see it in Europe and the East Coast. And in the BF strain, these are all Omicron strains, but we worry about these because they may not be well controlled by either the vaccine, by previous disease, and the biggest concern is they may not be controlled well by the monoclonal antibodies. So these are all things we're worrying about coming in the next few months. But right now in Oregon, the number of cases is relatively low. The number of cases in Douglas County is low. It's one of our lowest case counts in a year, and that's certainly a good sign. The number of people in the hospital has been quite low, less than 10 almost every day. But strikingly, almost all of the people in the hospital are not vaccinated. And certainly we've not seen anybody who's been vaccinated and up to date. And so we're really asking people to get up to date on their vaccines. For most people, that means get a bivalent booster. The bivalent boosters are widely available in doctors' offices, pharmacies, and still in our drive-through clinics. So through this week and next, on Thursday and Friday, there's the drive-through clinic at the old Colorcraft building on Diamond Lake. They're offering all of the different kinds of vaccine, but especially important, I think, is that people get the bivalent booster. In addition, we're starting to see a little bit more flu in Oregon. Not a lot of cases, still in the teens, but we worry that once flu gets into the community, it could certainly spread. So we're also encouraging people to go ahead and get their flu vaccine. So flu vaccine, covalent booster vaccine, bivalent booster vaccine, really important to get. And again, we're going to be there. One of the questions that came up this week was, do I really need to get the booster? Look, I've already had the disease and I've already had my other boosters. And the answer is yes. The immunity after an infection or after a vaccine is not long lived. So if you were unlucky enough to get COVID, say back in January, February, by this winter, you've been almost a year since you've had that boost, and you're going to be at risk again. So even if you've had the disease, even if you've gotten the previous boosters, we're really recommending that you go ahead and get the bivalent boosters. The other question that came up is about what about the risk of this myocarditis? Well, much of our best information about the COVID pandemic has actually come from Israel. Israel has a healthcare system where they have these managed care organizations, and just a few of them that cover all of the population. And so they keep very good records, very good electronic records. And so they're able to really carefully follow side effects. And one of the things we've been very concerned about is this myocarditis following the Moderna or the Pfizer shots. Well, the good news is that the myocarditis was rare, about 2 in 100,000. So that's pretty rare. And all the cases that they recorded were mild, where people got this disease, they recovered from the disease, and they did well. This is contrasted with the disease of COVID itself, which has been fairly quite serious for people of all ages, obviously more for seniors than for young people. But this was very reassuring news to hear that myocarditis was rare and in most cases really quite mild. So again, please go ahead and get your booster. We're also asking people if they're sick and get tested to get tested both for flu and for COVID, because certainly early on, the symptoms of COVID and the symptoms of flu can kind of overlap. So joining us today is Mitchell. So Mitchell is our TPEP coordinator. Mitchell helped us out through the COVID pandemic. Early on in the COVID pandemic, we needed people to help follow people and to help people deal with COVID. So one of the things that Mitchell and others did was to work with people who had the disease, be sure that they had food and other kinds of things that they needed so they could have successful quarantine. And when we needed more people like that, Mitchell was top on my list to call, and I called him and he joined the team. Now that COVID is quieter, Mitchell's moved on to become our tobacco person. So Mitchell, welcome.
Yeah, thank you so much for that warm welcome.
Yes, and someday Mitchell will be going to medical school, and so hopefully he'll be back to provide care in Douglas County. But right now you're working on tobacco, and tell us about how big tobacco is, or how much of a problem it is for people in Douglas County.
Yeah, okay. So I like to start with just a little bit of background. So the TPEP program where I work really started in 1996, and that was when Oregonians passed Measure 44. And so what that did is it raised tobacco tax and really funded this program. And since then, the program has been really strongly successful. So when we look at the per capita cigarette pack sales, in 1996, we saw about 94 pack sales per capita. And today we're down to about 30. So that's just about a threefold decrease in sales in about a 20-year period. When we look at the tobacco prevalence in Douglas County, we have about 20,000 adults who regularly smoke cigarettes. And so that's about a quarter, 25% of adults in Douglas County. And that is actually higher than the state and national average, which is about 16%. When we look at age groups who smoke, we actually see the slightly increasing trend from age 18 to 65. And so this means we see a slightly more smokers as the population increases in age. However, at age 65 and onward, we actually see this drastic decrease in adults who use tobacco. When we look at teens and those who are under 18, we have noticed a really quite sharp increase in tobacco use. In 2013, about 5% of the 11th graders used tobacco. And in 2019, that has increased to 23%. So that's over a fourfold increase. When we ask 8th and 11th graders, what was the tobacco product that you first tried? Overwhelmingly, 70% of them responded that really e-cigarettes or vaping was the first tobacco product that they used. And when we look at the pregnancy status in Douglas County, about 1 in 5 women who give birth use tobacco in Douglas County. And actually, really, Douglas County has one of the highest tobacco rates among women who give birth. When we look at the state, only about 7% of women who give birth use tobacco. So that's really what we're kind of looking at in Douglas County.
And so for people who may know that I've worked for many years as a pediatrician, and taking care of babies whose moms smoke caused a couple of issues. One is that those babies were considerably smaller than babies who were not exposed to smoke during pregnancy. And those babies then took just a lot longer to gain weight. And so what we saw was, they were cranky and they hard to gain weight and they were hard to feed. The other thing is that they went through tobacco withdrawal. And so you could easily tell the babies whose moms were heavy smokers about a day or a day and a half after birth, they'd start going through tobacco withdrawal and they'd really be really cranky. And as we all know, for babies, the first few weeks of life is so very important. And spending those first few weeks of life being so cranky is really a problem. So this is a problem both with smoke, which causes higher carbon monoxide levels in the lower birth weight, and with nicotine. So nicotine is a problem, but it's especially a problem for babies who are just born because they are going through nicotine withdrawal. So Mitchell, you said that most of the people are starting with e-cigarettes and then moving on to cigarettes.
That's correct.
And tell me a little bit more about that, if we know anything more about why that happens.
Yeah. So, when we do these big surveys and we look at the schools and we think that really the reason that teens and young adults are starting with vaping is really due to the tobacco, the flavoring of it, right? It's much more attractive for teenagers. And additionally, the advertising from tobacco companies is much more appealing to these young youths who see these teenagers as future clients for the tobacco industry.
We're also seeing, I think, that for people who have tried tobacco, maybe when they were teens, they got sometimes so sick from the smoke that they said they'd never do this again, and thus never got addicted to the nicotine. Whereas on the e-cigarettes, you don't have those negative first experiences, and then people become addicted to the nicotine and then can move on to smoke or other things. Well, Mitchell, I know there's a couple of plans that you're working on right now to reduce teen vaping, which later leads to teen smoking, to work and especially work with pregnant moms who are using nicotine during their pregnancy. So we'll have you back in a few months to go ahead and talk about how those projects are going.
That sounds great.
Until then, this is Dr. Bob Dannenhoffer, Public Health Officer for Douglas County, with another of our COVID conversations.
Thank you.